Hello, I'm Dr. Ashi Manoff.
I am Kayla Karmis.
Yeah, and we're here from CORE, Center of Relational Empowerment.
hmm
I'm a clinical psychologist, and what?
I am an advanced extern going into my fourth year of my doctoral degree.
Yeah, so you're getting your PsyD to be a clinical psychologist.
I am, yes.
I'm kind of like a couples therapist connoisseur at this point.
hmm
It's not something I went into school thinking I would do a lot of, but at this point, I work with lots of different couples from different backgrounds, people from like different cultures around the world, gay couples I've worked a lot with, and I'm all in on couples therapy. I think it's great. I've seen it work wonders, and now I'm helping you learn about couples therapy,
hmm
and you're getting your new experiences with it.
Yeah, and it's been wonderful thus far. Challenging in some ways, but I think definitely at core learning a lot about couples therapy and how to navigate that.
There's a psychologist on YouTube. He's in the internet realm. His name's Dr. Orion Taraban. He's a legit psychologist. He has a
hmm
PsyD, and he does a lot of content, educational content. Now, some of the stuff he does is pretty controversial, and I don't want to get into that, but he did make a video basically saying that he doesn't think couples therapy works.
mm
And so I wanted to react to it. I haven't actually seen the video, but I thought it'd be interesting to see an actual psychologist what his spiel is on it. So the title is Couples Therapy. He does give a little bit of a parentheses, right?
hmm
Almost never works in all caps. That's a pretty big statement. It almost never works.
Yeah, I'm excited to see his perspective
Mhm.
and why he thinks it doesn't work.
Yeah, and I completely disagree. So I think that it works a lot. I think sometimes it doesn't work, but I definitely wouldn't agree with this statement. It almost never works. That's pretty bleak.
Yeah. And
Yeah.
even as a trainee and learning more about this, I'm already seeing it work.
I would say for most of the clients I work with, it works.
hmm
And there's caveats to when it doesn't work and why, and I'll talk about that. But I'm
hmm
curious to see what Dr. Taraban has to say, and then we'll just see. He does have very nice, beautiful blue eyes. All right.
I'm Dr. Orion Taraban, and this is Psychhacks, Better Living Through Psychology. And the topic of today's short talk is couples therapy almost never works. In most couples therapy, the client is the relationship. The client is not the two individual people in the room. The client is the relationship between them. This means that the therapeutic intent is typically to perpetuate the relationship, or in rare cases, when both parties are on the same page with termination, to help dissolve the relationship harmoniously.
Okay, so I agree with parts of what he says, and then I disagree with other parts.
I agree.
So it is true, at least for me, that when I'm treating a couple, I do conceptualize the client, like singular, as the relationship. Now that is kind of an abstract thing. Like we could argue, like, what does that even mean? But he starts to say that it's serving the goals that they have as a couple. And that is how I start off all my couples therapy, is
hmm
basically asking what are your individual goals for the relationship and what is the goal for the relationship itself. He kind of seemed to imply that the goal is to kind of like keep the couple together.
Yeah,
That is not the goal. The goal is to help the couples work on whatever their goals are for the relationship.
exactly.
And sometimes that is one person wants to stay together and the other person doesn't want to stay together
hmm
and is maybe hesitant. We're trying to figure out what that is. And we can talk about that and through time see what happens. I do agree that sometimes in couples therapy, we can decide that the relationship is not the best to continue.
hmm
And we can ethically and responsibly and like honoring both people, the history of the relationship, close together. And it can be quite beautiful because a lot of people end relationships and they just kind of like, they just say like fuck off and that's
Yeah.
about it.
hmm
This is like we're gonna actually okay sit together and like talk about why we made this decision. How do we feel about each other? What do we appreciate about it? And that is a part of couples therapy, even though the name implies that we're trying to like keep you together. I disagree with that.
Yeah, I would also say, from what I'm hearing from him, it sounds a lot of like you're only conceptualizing the partnership. Like you're
Mm.
only conceptualizing them as a couple, when in reality, I feel like even what we've worked on in supervision and things along those lines is
Mhm.
how are we also conceptualizing them as individuals? And like,
Yeah.
what are they bringing to the partnership? So I think just the blanket statement of like, you're only working with the couple is true, but also there's caveats to that.
Yeah, there's more nuance than how
Exactly.
he's describing it. Yeah, so he hasn't really gotten into why it's a problem. So
Mm-hmm.
I agree with some of his premises. I
Mm-hmm.
think he also can overgeneralize and make statements that I don't agree with, like the goal is to keep the couples together.
Mm-hmm.
But let's see what he says next.
Mm-hmm.
Personality disorders hardly ever go away entirely, and it can take years of hard work just to get them under control.
Mm.
You'd be better off cutting this off and finding someone else as quickly as you can. By the same token, the therapist is not going to turn to the woman in the room and say, this guy is never going to commit to you, no matter what sacrifices you make for the relationship. If you want a family, you are wasting your time here. Withholding this feedback because your client is the relationship, irrespective of the best interests of the individuals in that relationship, does not sit right with me personally.
That
What do you think about that?
was very emotionally charged, I feel like, and very much like my opinion is you should never stay together with this person or you should
Mm.
move on. Things along those lines.
Mm.
When in reality, that's his opinion. And I don't necessarily think that that's always a beneficial thing to tell a client. We're not really supposed to be telling the client our opinion in the matter
Mm.
because let's say somebody is with somebody who has a personality disorder.
Mm-hmm.
Shouldn't they come to that on their own terms that they want to leave that person or stay with that
Mm.
person or work in couples therapy while their partner is in individual therapy, things along those lines?
Mm.
Like you mentioned earlier, I feel like there's a lot of nuance when it comes to this.
Yeah, it's weird because I kind of agree with him and then I also don't agree with him. To give him, some credit here, there are many times, this isn't just couples therapy, this is just therapy in general, where you're sitting across from a client and you're thinking, why are you with this guy?
Of course. Of course.
Like, that is true.
Yeah.
And there are times where I've been working with couples where I know in my heart that it would probably be better for them to split up.
Mm-hmm.
However, that doesn't mean that I'm right or that it's actually ethical or responsible for me to tell them that directly. There have been times in which I had couples sitting in front of me and I was like, they are absolutely screwed. Like, there's no way. And then 2 months later, they're like best friends again. I am surprised all the time by couples and how you feel on day one, or even in any individual session, does not dictate how things are going to turn out.
Exactly.
Now, it seems like, he's right that there are lots of therapists who take an indirect approach that does not give full feedback. But for my own, I can only speak for myself.
Mm-hmm.
I actually think there can be value to saying what he said, just not as direct.
Yeah.
Right?
Yeah.
If I'm feeling, why are you with this person? Like, this is someone who you say week by week is abusive and not meeting your needs. I might be feeling like I want to just say, like, you need to just get out. Like, this is obviously not helpful for you. I've felt that before. But there are ways of it's called a here and now
Mm-hmm.
approach where sometimes therapists will actually disclose their feelings
Mm-hmm.
as a way of acknowledging some dynamic that's happening within the room as information.
Mm-hmm.
And so the therapist, if you've built enough rapport with clients and you do this responsibly, might say something like, I'm feeling frustrated because it seems like we just keep doing the same thing over and over again. And the sense is, you keep saying there's all these reasons to leave and yet you're not. What I find myself asking myself, like, why won't you just leave? And instead of saying you should leave, it's more putting it on the client of,
Mm-hmm.
what do you think about that? What do you think's going on here? And that gives the clients an opportunity to process themselves the situation in the room while being honest about your feelings in the moment responsibly.
And I feel like it can be really valuable to ask a client, help me understand.
Mm-hmm.
Like, help me understand why you're here. What are your goals? what do you see in this person? Sometimes, like, and I feel like that can be valuable because sometimes they've never been asked that question
Mm.
and they need that perspective shift
Mhm.
or to be able to really sit and think, why am I with this person?
Yeah.
So I feel like even that help me understand question can be really valuable sometimes as well.
Yeah, Dr. Taraban's making a jump of saying, I know what's right for you,
Mm-hmm.
and I can't tell you what's right for you because I want to do therapy in the way in which he's saying therapy is where you just don't tell people what to do, which I
Yeah.
actually agree with to some extent.
Mm-hmm.
But I do think there's a leap here. There's almost like an impatience that I'm
Yeah.
feeling from him of like, process therapy is helping the clients, like you said, be able to talk about why am I here,
Mm-hmm.
despite the fact that maybe it's blaringly obvious to everyone in our lives that we shouldn't be together. Why are we here? That's important. That's therapeutic.
Yeah.
Just giving up and saying, you're going to go and meet, you're just not compatible. The people might break up, but they're still holding on to those same internal worlds and emotions that brought them together. And how people often do is they just repeat the same dynamic in another relationship.
Exactly.
There's something keeping them together, even if it looks bad from the outside.
Mm-hmm.
And I would be curious about that.
I'm not a big fan of compromise, especially in intimate relationships. Compromise is two people not getting what they want. The reason why a relationship is dysfunctional could be that at least one of the people involved is acting like an emotional terrorist. Appeasement didn't work for the Nazis, and it's probably not going to work for your relationship. Now,
He's using very loaded terms.
Yeah.
I find myself agreeing with him a little bit
Mm-hmm.
about certain things, and then he kind of like adds another like
Layer.
layer to it that's like feels a bit exaggerated.
Mm-hmm.
Not that that doesn't exist, but I actually agree with you. So the one thing he said was that compromise leads to both people actually not getting what they want. And I think that that is actually true a lot of the
Mm-hmm.
time. So when I
Mm-hmm.
talk to clients about compromise, what we don't want is, you want A and I want B, and because we're in a relationship, I'm just going to take one for the team and say, you know what, fine, just A. We'll go with A. Because in that situation, I'm losing, and when that happens, it can lead to resentment.
Yeah.
And then you might feel like, well, I got A, but now, my partner didn't get what they want, and
Mm-hmm.
that's clunky. Like it's imbalanced. I try to work on, is there a way we can actually talk about what A and B means to you, what you really want within A and B, talk about it further so that we can find a solution where we actually are both happy.
Yeah.
That is harder to do, but it involves taking time and process and figuring out what each person wants,
Mm-hmm.
and having a mature dialogue about, is it actually possible for A and B to become C for both of us?
To exist at the same time.
Yeah. One client wanted to get a dog and the other client did not want to get a dog.
Okay.
Right? And so the question becomes, compromise is either she takes one for the team and doesn't get a dog, even though that's what she wants, but she doesn't
Mm-hmm.
want her husband to be upset, or he takes one for the team, she gets a dog, and then he's just like, I love you, fuck it, like just do it.
Yeah.
But the problem with that is that one person inevitably ends up unhappy with what's
Mm-hmm.
happening. What is it about a dog that you don't want to have a dog? Tell me more about why you don't want to get a dog.
Mm-hmm.
And he said something like, well, I just don't want to deal with the responsibility. I don't want to feed it. I don't want to take it for walks. And it's not that having a dog itself is inherently bad. I'm fine with it. It's not like I'm allergic or it's on the
Mm-hmm.
couch. It bothers me. It's just a lot of responsibility I don't want to take on. And she said, I'll do it. She's like, I want a dog so much that I'm willing to actually do like 100%. Obviously, there's some extenuating circumstances, but like 90% of the work,
Mm-hmm.
because I want a dog. And if you're willing to get a dog and I do those 90%, I'm actually happy to do that. I don't mind.
Yeah.
And that is a better outcome when she gets a dog, she gets what she wants, and he gets what he wants, which is not having to be 50% of the responsibility. Because that's what he actually didn't want. It wasn't really about the dog. And then we have a new plan, which they actually both get something from it that they want.
Mm-hmm. when you're explaining this, it's a lot about how is the couple communicating about their said goals.
Yep.
Or let's take the dog, for example. How are they having that conversation prior to couples therapy versus in couples therapy, and how is the resolution? And I think that's the biggest difference is, yes, if you're compromising all the time, it's going to build up resentment. And resentment is very much a killer of relationships. So it's about how are you effectively communicating your wants and needs in a relationship.
And as couples therapists, we teach those skills, evidence-based skills for navigating conflict and communication. You know, I'm always talking about Gottman couples therapy, the antidotes of the Four Horsemen. We're trying to teach couples skills to navigate conflict together respectfully in new ways, have those new skills, and on top of that can include how do we find a solution without one of us having to compromise.
Exactly. And it almost sounds like he's saying, like, let's take the dogs, for example. It's almost like he would say, you know what, this person doesn't want a dog, don't get a dog.
Yeah.
It
or
seems
break
very
up.
black and white almost.
Yeah, it is. It does sound very black and white. You want a dog, you don't want a dog, why are you together? Break up, get with someone who wants a dog, get with someone who doesn't want a dog.
Yeah, get a fish. I don't know what you want me to say.
And that's there's some truth to that, right? Like, it is true that sometimes we are incompatible and there's someone out there that we're more compatible with. But the hard work of life and couples therapy is trying to find that balance. It's easy to throw away somebody because there's some issue rather than do the hard work of working through it. Now, he described one partner as an emotional terrorist. You know, I'm not sure. Most of the couples I work with, it is true that there can be meanness and dysfunctional communication. Like, that's true.
Emotional terrorist. That was the
Yeah, that is, I'm not actually sure what that means. But that's part of what we're talking about. Like, how do you learn if someone's an emotional aggressor? That exists in families, it affects in relationships. That's a common feature of therapy is, are there better ways for them to understand what they're feeling and then learn ways to actually communicate that respectfully? That is something that often works. Sometimes it doesn't, right? There's some people with, you know, personality disorders. There's lots of different personality disorders. All of them are different. You know, someone who has antisocial personality disorder, right? Who, you know, exploits other people's rights and hurts people. That is different in a relationship than the vast majority of people that we see in couples therapy. And sometimes that can be contraindicated because of physical violence or something. And that's something to take seriously. It's not most therapy, in my experience.
There's caveats to abuse in these types of situations too. And like, how do we handle that in couples therapy as well?
You know, I think Dr. Taraban seems to be saying you're in couples therapy because you're not compatible. So stop wasting your time trying to fix the other person and go out and find someone who's actually better suited for you. Now, that can be the case, but I don't think most of the couples I work with, they fell in love for a reason, right? There was a version of them maybe years before they end up in your office where they were compatible. And so part of it is figuring out what was going on there. Is there a way that we can bring more of that into today's world where the context has changed? Maybe you have kids, you have bills to pay, you're older, there's so many factors. And that's part of the work of couples therapy. It can take time. It can take months.
Yeah.
You don't just say, we've changed, we're different, we're out. That's, at least I don't want to just go straight to that. And in my experience, and a lot of the couples therapists I know, I'm not going to be able to cite research right now, but I would bet that when taken seriously with most couples, it can be successful.
Yeah. And I think a lot of times people show up to couples therapy saying, we're not fitting right now, and what do we do to get back to where we were? Because life happens.
So how would you approach let's because what Dr. Taraban sounds like he's saying is, well, you don't fit anymore, find a different puzzle to go fit into.
Yeah, exactly.
How do you approach that then?
I think it's all about like, how are you communicating about the differences that you're having? And once I learn that, I feel like it gives me a lot of insight into how the dynamic is actually truly working.
Yeah, I think the puzzle piece is an analogy that implies a rigidness that is not necessarily there, right? Maybe it's more like we've formed into different play pieces.
Yeah.
But does that mean we can't move it around? Like what it's more, in my experience, my approach as a psychologist is to try to introduce more flexibility actually, rather than keeping rigidity. And that can help a couple that feels like they're not fitting. If they develop more flexibility, maybe they will be able to fit and still honor who they truly are.
Exactly.
You're the one who chose to be in a relationship with this person for some reason. You likely have some unhealed emotional wound that left you vulnerable to such an individual. And that healing is something that you could more effectively do in your own individual therapy.
There's another thing here where I do find myself agreeing with what he's saying to some extent. Now, you are responsible for your life.
Exactly.
You know, fault and responsibility, so we use them interchangeably. I do think that emotionally we can actually use them differently. I think fault is just a blaming statement, right? You're at fault for this just means you did this, you're at fault. Responsibility implies that there's something you can actually do about it, right? So yeah, it's true that it's our responsibility, who we're in a relationship with, assuming that this is a relationship where you're not, some people can't leave because of financial reasons, cultural reasons. There's, putting that aside, let's just say you are in a relationship where you could leave, and you're not. That is your responsibility. Saying it's your fault is a little bit harsh, in my opinion. I do agree with the premise, though, that there's a reason that you're staying, and maybe there's some unhealed wounds. I'm not going to be able to know who said this, but it was like, if you want to know how someone feels about themselves, look at the partners they choose. Yeah. There's a lot of wisdom to that. Like, there really is. So I can agree with that. I think there's work to do to look at, what's going on internally for you, individually for you, that's keeping you in a relationship that might be dysfunctional. And it is your responsibility. I think that when couples therapy really works, it's when both people are able to take responsibility for their choices, for themselves, for their values, owning up to themselves and how they're contributing to the relationship issues. That's when it really thrives, is when both people take responsibility. I agree. If someone can't take responsibility, the relationship it's not good for the relationship. Now, some people don't take responsibility at first, but over time, once we start to understand, what's happening for you emotionally that makes it difficult to take responsibility, through having compassion rather than saying you're at fault, having compassion and understanding for the reasons people are the way they are, which could include real negative stuff like being verbally abusive and stuff that can be there. I'm more hopeful, and in my experience I've seen people turn around and take responsibility in a way that it seems like he is a bit cynical about.
Yeah. Getting diagnosed with narcissistic personality disorder and working with that person in couples therapy is going to be very, very challenging.
Yeah, that's going to be challenging in any therapy.
Any context.
Yeah, it really is.
But I also do agree with the individual therapy aspect. I think individual therapy on top of couples therapy can be so beneficial, especially when you're diving into things in couples therapy that you would rather digest more in individual. I can definitely get behind that.
I agree as well.
Because one of the most common issues that couples typically bring into the counseling room is their sex life or their lack thereof. And you cannot negotiate desire. You cannot say, get more sex more often in exchange for doing more of the housework. It doesn't work that way.
I agree.
Now, you can increase desire in a relationship, but the pathway to doing so is almost completely antithetical to the couples therapy process.
Well, it's weird because I agree with lots of what he said.
Yeah.
But he makes a step, which is like, it's like, okay, I think it's true that spontaneity, adventure, attachment needs, space, literal physical space can help with sex lives, especially for couples that have been together a long time. I agree. Now, I don't know how that's antithetical to the couples therapy process. Like,
Yeah.
I will talk about that with couples, you know, it's almost like he's saying like investing so much in the relationship is going to be like a turn off or something because you're too invested in each other, you're too connected. Now, maybe, or, I talk to couples about, what can we do to introduce more spontaneity
Mm-hmm.
in your life, more adventure? Can you
Mm-hmm.
change the environment so that there's more likely that you're going to get turned on with each other,
Mm-hmm.
You're not going to get turned on necessarily in bed where you trim your toenails because the association is
Yeah.
not, oh yeah, we're in a romantic, you know, Airbnb or whatever. Like
Mm-hmm.
that, it's just like, oh, this is where I go to bed every night. And it's like,
Mm-hmm.
doing my taxes.
Yeah.
Now, we can talk about all of that. I don't know how that's antithetical to couples therapy. I
Mm-hmm.
think that's what often actually comes up in couples therapy.
Mm-hmm.
And knowing that as a couples therapist can actually help with dealing with those exact points that he was addressing.
Mm-hmm.
Maybe couples therapy is just not for him. Right? Like,
It's not for everyone.
yeah,
Yeah.
I don't do play therapy like with kids. I'm just,
Mm-hmm.
it doesn't feel authentic to me, and like
Mm-hmm.
my affect and how I like approach myself and like playing and all that. Like, it's
Mm-hmm.
great for some people, but I would never say it doesn't work. I would just say, it doesn't work for me and I don't do it.
Mm-hmm.
He does seem pretty rigid and like black and white around
I want to know what happened to
couples
him.
therapy.
Like, what experience did you have within
Yeah.
couples therapy that made you
Yeah.
this black and white in your thinking?
Yeah, and who knows? Maybe the type of couples he's worked with have been like really challenging, and I've had challenging couples. Like, I've had couples that are definitely fit what he's saying, where someone's just being abusive and like
Yeah.
he probably has a personality disorder.
Mm-hmm.
And that's a whole other conversation of like what is a personality disorder and stuff. But that's not most couples clients, and he's generalizing a lot to say just because some situations don't work. He seems to think most don't work. I
Mm-hmm.
actually think most do work.
Mm-hmm.
So, but it does depend the situation.
And when you're talking about like context of abuse,
Yeah.
we don't work with, when there's ongoing abuse going on, we don't usually work with clients, like couples.
Yeah, if it's extreme abuse. Yeah, like
yeah.
coercive, violent abuse. But there could be verbal. I work with couples that have verbal.
Yeah.
What would probably count as verbal abuse. It's quite
Yeah,
common.
same.
And usually
Yeah.
when we teach better skills, like they become less abusive because they find better ways to communicate what they're really feeling, which might be, you're a fucking bitch, right? Fuck you. What they really are, if we connect to what they really are feeling, it's I feel scared and I feel unseen. And then, it's like a totally different dynamic.
Yeah.
So on the surface, because something sounds cruel or harsh, doesn't mean it's the end all for the couple and how they are as a person. That's my belief. I think people are more flexible than that.
Couples therapy is more or less predicated on the belief that most problems that people experience in their relationships are just based on some lack of understanding or some failure of communication. So the solution, of course, must be more communication and mutual understanding. And in my experience, this is not the case.
I'm glad he said in
On
my
some
experience.
levels,
Yeah.
it's not important to understand why, say, one person is throwing temper tantrums. It's important that the temper tantrums stop.
Couples therapy is going to tell you to communicate more. I feel like it's it's more about the intentionality behind the communication. And we're not necessarily saying, oh, go sit down and have 3-hour conversations about why you think X, Y, and Z. When I'm working with a couple, I'm like, okay, you need to be way more intentional about what you're saying and how you're saying it, rather than thinking that they're going to go have conversations for hours and hours and it's going to fix it. Because if you're not effectively and intentionally communicating, you're just back in the same feedback loop.
Yeah. Yeah, I think he's both right and wrong again. Just understanding why something happens doesn't change anything, right? He seems more like a solutions oriented therapist, right? That, the issue isn't why you're screaming, it's that you're screaming. So you stop the screaming and that's your responsibility and then things will get better. Now, there is some truth to that. It's just that someone who's screaming like that, there's more going on than just saying stop the screaming. They're not going to stop the screaming just because you tell them to stop.
Yeah.
And this is where I think the patience comes in, right? He seems to be saying, look, if you're with someone who's screaming at you, just leave and find someone who's not going to scream at you.
Yeah.
Which there's like some logic to that. Like I get it. Now many people stay in relationships with somebody who's doing things like this because they love them, right? Love and attachment complicates the whole just fuck off and find someone else thing, right? And so I agree that couples therapy is often about building better communication. It's not just more communication, it's quality of communication and understanding, and also what are we going to do to change things that are maladaptive or harmful in a way that's meaningful for both people in the relationship.
I would find it really interesting to have a conversation about change with him.
Yeah,
and see his perspective on, do you truly believe that people can change?
Yeah, he does seem, I mean, it's odd because there are some people that genuinely don't change. That is true. That's just a fact of life. However, I wouldn't be doing this work if I didn't think that people couldn't change for the better and feel better through the process of therapy, which takes time.
Especially the people that are in therapy.
Exactly. The people who show up often are at least motivated enough to do some work because they're even in the office.
Exactly.
So
I notice more that the people that really should be in therapy are the people that aren't in therapy.
Exactly. Yeah, that's right.
That don't want to change and don't see anything wrong with their behavior or actions.
I actually agree with a lot of what Dr. Taraban said. However, he does generalize. He has this kind of black and white thinking that I don't think works for me in terms of my experience as a therapist. I'm a huge believer in couples therapy. It works for many of my clients. I recommend it for people that are considering it, and with the nuance that not all therapists are created equal, right? You might need to try different therapists. And part of the process of therapy is discovering whether or not you want to be in this relationship. It's not trying to keep you together. It's trying to understand who you are, who each of you are in relationship to each other, and move towards your goals. And sometimes that works, sometimes it doesn't. And that can be sad, and it depends on the content of like the other person's mind and their personality and all of that. But overall, I think this is a bleak representation, an inaccurate representation of what couples therapy is. And that's my opinion as just another psychologist out here in the world.
Yeah, I think I agree with what you just said. I think that it was very black and white thinking on from my perspective. But also from my perspective, from who I've worked with and the couples I've worked with, I think it can be really beneficial if you are doing it in a very intentional way. And I do believe that people can change and they can learn and grow, and they're not all just stuck in this black and white sort of nuanced sort of way of thinking. So yeah.
All right, well, this was fun. Thanks for doing this.
Of course. Thanks for having me.